You've heard a lot about the new coronavirus that causes COVID-19. After all, you've experienced firsthand just how much a virus can disrupt everyday life. Government officials instituted social distancing. Field trips, sporting events, and dances were canceled. You've texted friends and wondered when you can see them again. Perhaps the biggest change is that students were sent home from school and asked to start distance learning. Your teacher might even have assigned you this video to watch at home. You probably have questions about the novel coronavirus, and this video will answer some of them, including: what is COVID-19? How did it spread so quickly? What are scientists and researchers doing to fight it? And what can we do to help? First, what is COVID-19? COVID-19 is caused by a new strain of an existing virus known as coronavirus. It's called coronavirus because under a microscope, it looks like a crown. Scientists first called this a novel coronavirus because it's new, and novel means new. The World Health Organization named the disease caused by the novel strain of coronavirus COVID-19. CO stands for corona, VI for virus, and D for disease. The 19 is short for 2019, the year it was discovered. Some coronaviruses affect people and some affect animals. Scientists think this coronavirus started in a wild animal and spread to humans in a big city called Wuhan, China. From there, it began to spread from person to person. Because COVID-19 has spread internationally, scientists labeled it a pandemic. How did it spread so quickly? All it takes is a cough or a sneeze to spread a coronavirus. Because COVID-19 is so new, people don't have immunity to it and are more likely to get sick. But not everyone gets really sick. Many people show no symptoms or only mild symptoms. However, some become seriously or critically ill, which is why everyone is working so hard to limit the spread of the virus by staying inside. We know that people over 65 and those with underlying medical conditions, like high blood pressure or diabetes, are at a higher risk. Our doctors and nurses are working hard to make sure everyone is cared for. By staying home and social distancing, we help flatten the curve, which means we're preventing too many people from getting sick all at the same time. We want to be sure there are enough hospital beds and medical staff for people who may need them. What are scientists and researchers doing to fight it? The answer? A lot. Researchers are working as fast as they can to develop a preventative vaccine and treatment for COVID-19. Kind of like the flu shot and the medicine you take to treat the flu. Vaccines provide immunity for all kinds of diseases, including some you might not ever have heard of, like polio or the measles. A vaccine works by teaching your body to fight the virus before you are sick. A treatment directly helps you if you become sick by attacking the virus. But biopharmaceutical companies aren't just working on a new vaccine and treatment. Every day, researchers at biopharmaceutical companies, at governmental agencies, and at universities are working hand in hand to develop and make the medicines that you, your parents, and grandparents take. In addition to their work towards new discoveries to fight COVID-19, the biopharmaceutical industry is donating medications, money, and medical supplies to support organizations at the heart of the crisis working every day to help those patients facing COVID-19 and have an immediate impact. Researchers from around the globe are talking to each other and sharing what they know. They're taking the lessons they've learned from treating other diseases and past viruses and adapting them for COVID-19. And they're working on new ways to quickly produce a vaccine once it's developed. Biopharmaceutical companies and their researchers are in a race to stop COVID-19. It takes a lot of people and time to develop new medications and therapies, but these companies are willing to make the investment to ensure people all over the world are living longer, healthier lives. With so many researchers tireless in the pursuit to solve COVID-19, the world will get better solutions faster. What can we do to help? Again, the answer is a lot. If you are washing your hands well and practicing social distancing, you're already doing the most important things to stop the spread of coronavirus. Staying patient and keeping siblings entertained indoors are great ways to help. Believe it or not, you can also help by studying STEM: science, technology, engineering, and math. The scientists who are working on COVID-19 were once just like you, studying things like the scientific method. Every day, these researchers use this exact process. making hypotheses, conducting experiments, observing results, and drawing conclusions to help as many people as they can. These former students are now innovators on the front lines of scientific research. You can join this team of heroes by doing your best in your STEM classes and participating in STEM extracurricular programs, all of which you can do while participating in distance learning. Studying might not sound like heroic stuff, but it is. We need you to become the innovators of tomorrow who can fight the diseases and find the cures of the future. And your work starts today.